Go.
Hey, my name is Christopher Clayton, and today my topic is going to be about the importance of cholesterol screening. I chose this topic because high cholesterol is a growing problem, and I want to raise awareness. So the first thing I'd like to do with y'all, just kind of see what y'all know about it. We're going to do what they call a KWL chart. K is for what you know, W is for what you want to know, and L we'll do at the end to see what you've learned after it all. So what do y'all know about high cholesterol, or what it could lead to, or just anything in general?
Fatty foods cause high cholesterol.
Fatty foods.
It's bad for you.
Bad for you. Is there anything else y'all know about it?
I don't know much else about it.
Alright. What would y'all like to learn about it?
What ages you should get checked at?
What ages? Alright, what else?
What happens if you have high cholesterol?
What happens? And then what else? Anything?
Lifestyle choices to prevent high cholesterol.
Alright. Mark with me, because if I don't, I'll end up losing. I'm never going to forget stuff. Alright, so the first thing we'll talk about is what age we should get it done. Phyllis Moons recommends that adults age 20, she's a professor from UWA, recommends that adults age 20 years or older have their cholesterol checked every 5 years. Now, a normal person, you would get it checked around 50, but if you have a pre-existing family history of like heart disease or high blood pressure, diabetes, you would want to get it checked around 20, because the earlier you detect it, the more, less likely you are to, get problems down the road. High cholesterol can also develop in early childhood or adolescence, and your risk increases as your weight increases. Kristen Anston from Harvard Extension School states it is important for children over 2 years of age to have their cholesterol checked if they are overweight, have a family history of high cholesterol, a family history of heart disease, diabetes, high blood pressure, or certain chronic conditions such as kidney disease. In the United States, more than one-fifth of the young adults aged 20 to 25 years of age have at least one abnormal lipid level. And there's there's three that I'm aware of. Your low dense, your high dense, and then you have your triglycerides, which is fat in your blood. And your low dense, those are kind of like the bad ones. You want some, but you don't want a lot. You like the HDLs, the high dense, to kind of clean out the system. And then the second thing I want to talk about was what high cholesterol could lead to. High cholesterol can lead to serious health problems, or even, in some cases, death. Coronary artery disease remains a major health concern for adults. Lauren E. Taylor, professor at the University of Oklahoma, stated that approximately 15.4 million individuals in the United States over the age of 20 have coronary artery disease. In 2009, one in every nine deaths was contributed to coronary artery disease. The disease accounted for approximately 387,000 deaths in the United States. Another factor that plays into high cholesterol, strokes, are another major concern for people with high cholesterol. Stroke happens when fatty-like substances known as cholesterol block up a vein in the brain and rupture. I have a little video on how it all works. The coronary artery is going to lead to.
If we looked inside the chest cavity, we would see the lungs and pericardium, which is the fibrous covering of the heart. We could also see the heart beating. Here are the left and right coronary arteries. They supply blood to specific regions of the heart. If either is damaged or blocked, it could injure the heart wall. In a healthy artery, red blood cells flow through unimpeded. But if the inner wall is damaged, cholesterol plaque can build up. This progressively narrows the space through which blood flows. Eventually, the artery may become too narrow for clotted blood to pass through. If it does, the artery could become completely blocked. That would cause a lack of oxygen, or ischemia, in the part of the heart the artery supplies. The result is a heart attack, known as a myocardial infarction.
Another thing I wanted to learn is lifestyle changes. What lifestyle changes can you do to prevent high cholesterol? Preventive guidelines for cholesterol screening among young adults differ, but experts will agree on the need to screen young adults who have other risk factors for coronary artery disease such as obesity, high blood pressure, and diabetes. Less than half of the young adults who have these risk factors don't get cholesterol screenings, even though up to a quarter of them have elevated cholesterol. A simple blood test called a lipid protein profile can measure your total cholesterol levels, including LDL, which is your bad cholesterol, low dense, and HDL, your good cholesterol, which is your high dense, and triglycerides, which is just fat in the blood. Your doctor may prescribe medications to treat your high cholesterol. In addition, you can lower your cholesterol levels through lifestyle changes such as eating fresh fruits, vegetables like broccoli, lettuce, all those good things, and whole grains. Getting at least 30 minutes of exercise, 5 times a week, can substantially lower your risk. And also, not smoking. And I have a little hands-on project for y'all. Got some plates here, and I want y'all to pick out some good foods that y'all would think would be good. Just dump them out. See which foods y'all would think would be good or low in cholesterol or healthy for you. Kind of a little bit of everything in there. Stuff's all rolling around down the couch.
Alright, I think that's it.
Alright. Yeah, Alex over here's got a bunch of good things. Got some oranges, bananas, grapes, lettuce, watermelon. Man, you must like watermelon. You grabbed all the watermelon from Alex. He got the same thing. Got some lemons, oranges, tomatoes, a pear, some bread, whole grains. Oh yeah, that's good. Good job. Here's the camera back. Alright. Now that we've went over those 3 points, what have y'all learned about high cholesterol and whatnot? To answer this question, what age should we get your cholesterol checked? If you're normal, and then if you have you have family history.
If you're normal, around 50, and if you have a family history, 20 to 30.
That's right, exactly. And then, what could high cholesterol lead to?
Cardiovascular disease, heart attacks, possibly death.
Mm-hmm. And stroke is also another one. All right. And what's some lifestyle things that we can do to help lower our cholesterol? Like foods or anything like that?
Eat all those fruits we talked about a second ago, and exercise 30 minutes a day, about 5 days a week.
Fruits and veggies. So all the greens and whole grains. Alright, and then you want to get at least 30 minutes of exercise, yeah, like you said. Alright. Well, we got that pretty much filled out. Now that we know the importance of cholesterol screening and what age we should start getting it done, the problems that you could face if you don't do so, and finally, what you need to do to keep your cholesterol low. Cholesterol screening may just save your life. If you or someone you care about has had a heart attack, you could very well be a candidate for high cholesterol. And that concludes our session for today.